to the MR room or to the CT room in a severely traumatized patient. There is sudden spurt of the musculoskeletal injuries due to the high you can say trauma, incidence of high trauma due to the vehicular accidents and also sports injuries. Where we can look for the indications, biggest indication what we can call. Can I have a pointer, please? Pointer and laser pointer. Otherwise, the biggest group is the trauma. We can call it trauma. Then, of course, in infections in our country, particularly in Asian countries and of course in African countries, we get a lot of infections, and it is a lot of clinical guess business. Whether this is something a tumor or it's some malformation or some bone infection or something. Then ultrasound. Then, of course, we also having the parasitic infestation, and that is also. And then tumors. Evolution of the tumors, degenerations, metastasis, vascular masses mimicking, and of course the muscle dystrophy. All this thing we can find out on ultrasound using 5, 7, 10 or at times 12 to 15 megahertz depending upon the location of the pathology, site of the pathology and all those things. So what are the normal tissue and how the muscle looks like? What we can say, it looks like normal appearance. We can see it looks like a bipinnate normal sononatomy. We can see here how beautiful it is seen. This is the muscle capsule. These are the mycelium fibers. These are the intermuscle facta, and we can see the bipinnate skeletal muscle pattern. It is almost similar to the graph of a muscle which we can see on with our naked eye. So that we can see here with muscles, and this is a normal muscle, bipinnate, unipinnate or circumpinnate muscle pattern. Where we can use it in a trauma. Muscle gets injured by two types of the trauma. One is the muscle rupture, that is due to the direct trauma or known as a compression injuries, and second is the dissection injuries or elongation trauma. Compression injuries, when it gets compressed against sudden force and become injured and D-shaped, and rupture of the muscle take place. A situation like this, what we can call here a biceps muscle rupture and compression in the vehicular trauma seen here in the arm, and elongation trauma where indirect force makes the muscle to stretch beyond its limit, and that it gets hurt and then the fiber gets ruptured. Such situations like this, when some weightlifter is lifting the weight or somebody is pulling or something, and suddenly there is excruciating pain they develop, and that is indirect trauma, and where we can see the rupture of the muscle, and this is the elongation trauma or indirect trauma resulting into the rupture of the muscle in a gastrocnemius muscle of the leg, and at times small, not only that, not compression, not elongation, but small contusions. They are very painful, and that we can see here a small contusion injury seen on the anterior compartment of the leg, where we can see the small hematoma with lot of fluid collection and perifocal edema seen, and this is the hematoma which we get on accident and small contusion of the muscles. After that, this is again you can see here the rupture of the muscle which is seen over here. This is the biceps muscle in a weightlifter who developed sudden pain while lifting the pain, and there is a sudden elongation trauma, indirect trauma, and this is rupture of the muscle. This muscle gets ruptured and that bulge is there, capsule got broken. Again you can see a compression injury where muscle got compressed against the pressure and the trauma over here, and this is a soleus muscle. Here we can see in the calf, and this is the elongation trauma, a shearing effect which is taking place in the whole of the muscle. You can see here in a gastrocnemius muscle, and big tear running from here to here, and this is the compound imaging. What we can get now, we can get the compound imaging, or we can get the real-time scanning the whole of the imaging of the muscles, because the long muscles, if it is not covered in a one frame, then we can have the sweeping effect, and this is a compound imaging where you can see the whole of the shearing muscle tear seen in the gastrocnemius muscle. Not only that muscle, we can evaluate the healing process and also the hematoma formation, and hematoma formation evaluation can be done with ultrasound, and this is the hematoma which is seen in the upper arm resulting in pressing over the muscle, the vein, axillary vein, and also over the brachial vein. The patient was referred venous study of the arm swelling. what we get everywhere in the body, and it is where we can see the point is this: why ultrasound is so helpful. Clinically, it is not possible how big is the hematoma. Clinically, you cannot see. Apparently, by naked eye or palpation, it may look like a small hematoma, but ultrasound helps know it's looking like it's like an iceberg, tip of the iceberg, where it looks like only tip is seen, but the hematoma is so big, which is seen covering deep and which you cannot palpate clinically. So this is the story with hematoma, where ultrasound can help you. Like this, a small child of only of 3 years of age then fell down and had struck his belly anteriorly, and this is a big rectus sheath hematoma which is seen over here. You can see it's a rectus sheath hematoma in the anterior abdominal wall, and you can see a chest wall hematoma. Again, due to direct injury, there is a chest wall hematoma which is confined, well-defined, loculated hypoechoic mass seen here in the chest wall, and this is the anterior abdominal wall hematoma, a rectus sheath hematoma which is seen sustained in a young child. Then we can see again a big hematoma is seen which is in the pectoralis muscle. This was referred as a breast tumor. Patient was having a breast tumor, so clinically suspected breast tumor, but it was actually not the breast tumor. It was a chronic hematoma which is seen the pectoralis muscle major. So this why ultrasound can differentiate. No, this is not breast. This is a rectus sheath problem, and breast is absolutely fine. So in that way, it can help you in deciding what is the pathology. Then coming to the injury, there is a process after that injury. The body starts that process, the healing of the injury, and ultrasound is very helpful in evaluating the healing process. What is happening? Type how whether it is process starts with the hematoma formation, organization of the hematoma, resolution of the hematoma, then of course the fibrosis and how much it is which has taken place. Clinically you cannot evaluate, and that you can evaluate only by ultrasound. Healing of the muscle rupture, magnitude of the scar formation can be seen with ultrasound. Infrequent complications like cystic degeneration. This is again a pathology, is a healing process where muscle gets undergo cystic degeneration, and here we can see here the degeneration of the muscle. Total normal anatomy has gone. These are the fat globules which are seen floating in this degenerating muscle, and which you can see here. This is a chronic muscle injury resulting ultimately led to the cystic degeneration of the muscle. Then this is also a complication, myositis ossificans. Again, it's a chronic healing problem and resulted into the new bone formation. The new bone formation starts taking place and result into chronic pain, and then we can see the muscle contained in the hematoma formation may calcify and ossify, resulting into the myositis ossificans formation. Problem is of this is a limited movement of the organ or the arm, limited movement plus chronic pain and and all this we can see here. This is the arm, this is the humerus bone which is cut here, this is the normal compartment, and this is the myositis ossificans. Well defined, highly echogenic mass which is seen having the punctate calcification which is seen here is a myositis. Thank you. Ossificans. Okay. So all this thing we can see here. Not only that, at times we can get the popliteal fossa, the swelling, whether this is a vascular swelling or there is something else or tumor, but at times we get the cyst, and this is the cyst which is seen here in the Baker's cyst in the popliteal fossa, and suddenly if it gets ruptured, then it results into many type of complications like excruciating pain, pressure over the popliteal artery resulting into the vascular insufficiency, and this is a rupture. This is the plain Baker's cyst which is seen here, and this is the ruptured Baker's cyst which is showing you the hemorrhage in the cyst, plus pressure over the popliteal artery. Lot of aliasing is seen due to the compression and high flow which is going through this popliteal artery, and this is the blood which is seen in the ruptured Baker's cyst. Not only that, at times infection. Ultrasound is very good in evaluating the infection. This patient, clinically they thought it's a case of the VIC, vascular ischemic contracture. You can see here, if you can see, this is the ulnar contracture. Fingers are contracted. But there is a swelling over here. And this, when we got the bone X-ray done of the arm, the bones were absolutely fine. Nothing wrong with the bone. But there is soft tissue swelling over here, you can see here, and what it could be. And then we found that there is a big abscess which is seen over here, and this is a color flow shows the hyperemia and necrotic, and this turned out to be atypical tuberculosis of the forearm muscles. Results clinically presented at VIC. Same patient, you can see they presented at VIC here, fullness here, bones were fine. Again you can see the ulnar contracture, deviation, and this you can see here the fullness of, and these all other abscesses. This is the cortex of the ulna, and this is the muscle abscess you can see here, and this is the abscess, again atypical tuberculosis. Situation like this, what we can get in a girl who was having a freely hanging arm, no pain. The bones were fine, you can see here, these are the bones, the humerus, head, scapula, acromioclavicular joint and acromihumeral joint, they were fine. But what happened here? You can see complete degeneration of the muscles forming the shoulder girdle, right from deltoid, trapezius, trapezius, deltoid, triceps, all this thing they got degenerated. This is an humerus, cystic degeneration. This is a very unusual case. This turned out to be tuberculosis of shoulder. The tuberculosis of the shoulder is always, or most of the time, is dry. That's why it is not tabes sicca. But this was a cystic degeneration, liquefaction which was taking place in the patient and involving whole of the shoulder muscle girdle, shoulder joint muscles, and this is a cystic degeneration in a young girl. Then at times this patient was having highly painful joint, shoulder joint with mild fullness over here, you can see here, limited movement, acute pain, but the bones were absolutely fine. What is happening? And when we did ultrasound, we find again the muscles of the shoulder girdle disorganized. Normal mycelium, they are destroyed, you can see here. There is small areas are seen which are showing micro abscesses over here. These are the micro abscesses. Few small abscesses are seen. These are again suprascapular region. This is the trapezius muscle, and this is a diffuse myositis involving the shoulder muscle like trapezius, subscapularis, biceps, and small micro abscesses, diffuse myositis. Then coming to the situation like this, where we find this man who was having problem, this arm is absolutely fine, and you can see here, this is somewhere small contour, drooping, subdiscal hanging, but this is the X-ray which was seen here. Humerus is absolutely fine, scapula fine, clavicle fine, and this is the cystic degeneration. We don't know what happened. After 3 months, we were just given, the patient disappeared. After 3 months, the patient came, and you can see in the freely hanging arm, loss of the normal shoulder contour. This look is, and this is the X-ray which shows resorption over here. Surgical neck of the humerus, humerus diaphysis, head of the humerus, part of the scapula, part of the acromion, and part of the clavicle. They all gone. Patient was not having any pain except it was having a freely, and this is the ultrasound which shows you destruction, head resorption, and this is a neuropathic joint. I don't know how many people have seen this, because I saw this, I read only in the book. In my 20 years of ultrasound, I saw only one case. Neuropathic joint, usually they are seen in syringomyelia, hypertension, or diabetes, or he was having none of them. But then when I searched the literature, I found long-standing chronic sustained trauma can lead to this condition, and he was a laborer who was doing lot of labor work on his head and by this shoulder, and that was the reason that was. So what we can see,